So, Bhavesh sir, shall we start?
Yeah, certainly. I think we are already 6 minutes past 8. Sure.
Yes. So, over to you, Gaurav. We can start.
Good morning, everyone. On behalf of the PG Education Committee, Psychiatric Society West Zone, I extend a warm welcome to all of you to this Scholarly Sunday session, Edition 4, Series 4, Edition 4, on the topic Career Options After MD Psychiatry, a panel discussion. I am Dr. Dron Bandutia, Assistant Professor at Namo Hospital, and I am honored to moderate today's session. Choosing a career after MD psychiatry is like choosing a specialty in IPL. You want to be a batsman, you want to be a bowler, you want to be in private practice, you want to be in academics, or you want to be an all-rounder, a bit of everything. In private practice, though, you are your own captain, you have your own set of rules, but you also have to handle a lot of other things. Moving ahead, we are incredibly fortunate to have Dr. Sudhir Bhave sir, President of Psychiatry Society West Zone, with us. I would request Dr. Sudhir sir to please share a few words to mark the beginning of the session.
Yeah. Thanks a lot, Ron. It's a great pleasure again being here on this scholarly Sunday mornings. Now, I was just thinking, I mean, if you look at the trajectory of all the events or programs that we are having through this subcommittee, I mean, that shows a very nice ascending graph. I mean, and very timely, like common mistakes in practical examinations, then what to read from where, and then going on to, I mean, after MD what. So I think that's a very fantastic conceptualization by Dr. Sushil Gawande especially and his team. And I mean, this is a kind of program that you just cannot afford to miss, and you do not want to miss from the points of view of PGs. So I think the theme is extremely attractive, and I'm very happy to say that amongst all the programs of the West Zone, this program has been gathering the most number of eyeballs. I mean, most number of viewership, and it has beaten even the last few years record of PG attendance in these kind of programs for the PGs. So I'm very glad that something very topical, something very important. I mean, the PG examinations are just over, the results are coming out. So I think this is just the right time for such a program. The PGs, I think, as Drone very rightly said, there are too many Hindi film songs that I'm reminded of. "Main idhar jaun ya udhar jaun," those kind of things. So yeah, I mean, it's a wonderful topic, and I'm sure, I mean, the array of speakers has also been arranged very thoughtfully. I mean, from people who have passed their PGs very recently to senior people who have much experience with different kinds of professions within psychiatry. So it's great. Thumbs up for the entire team. I wish all the best, and I'm very sure that by the end of this 1 hour, the PGs who attend are going to be much more knowledgeable about the path they would like to take. So thanks so much, Drone. Over to you.
Thank you so much, Dr. Bhave sir, for those insightful remarks. I also would now like to welcome Dr. Sushil Gawande sir, Chairperson of the PG Education Committee, West Zone. I request sir to welcome us and to say a few opening remarks.
Thank you, Dron. First of all, welcome to all the team members and office bearers of Psychiatric Society Western Zonal Branch. I won't take much of a time, but I would extend my thanks to Aniket, Gaurav, Sagar, Varun, and as well as Dron for taking efforts to join this program and taking out time. And with my simple message, they accepted to be a part of this program. And I'm so glad for that. And I wish all the best to the panelists, to the moderator, and to the all postgraduate students. And I'm sure this is a right time. In Maharashtra, results are announced yesterday. So this is the first day after result where they can think of going ahead with their learning curve, or they can stop it and launch themselves in the private practice. So this is the right time for that. So without wasting much time, over to Drone for further proceedings. Thank you so much.
Thank you so much, Dr. Sushil sir, for your encouraging words. Now let's turn on our attention to the heart of our today's session, our esteemed panel. We truly have an exceptional group of experts that and each represent a unique and a valuable career post MD Psychiatry? I hope my screen is visible.
Screen is visible with that first flyer.
Yes, sir.
Yes, it's visible.
Yes. Thank you, sir. So first we have Dr. Aniket Shukla, sir, a consultant psychiatrist from Melbourne, Australia. Sir has done his MBBS, DPM, and MD, and is currently a fellow of Australian and New Zealand College of Psychiatrists. Sir is currently working in the NAMHS and at Northern Health Victoria. Sir has also hold various positions throughout his career in the form of senior residency, assistant professor, senior registrar, etc. I welcome you, sir. Our second panelist, we have Dr. Gaurav Kumar Singh, sir, who is currently an assistant professor at AIIMS Nagpur. Sir has done his DM in addiction psychiatry from NIMHANS Bangalore, and is currently working as assistant professor at AIIMS Nagpur. I welcome you, sir.
Thank you. Thanks a lot, Dr. Drone, and Dr. Sushil sir, for inviting me on this platform. Thanks
My
a lot.
pleasure. My pleasure.
Thank you, sir. Third, we have Dr. Sagar Bhalke, fellow of Child and Adolescent Psychiatry, who has done in fellowship in Child and Adolescent Psychiatry from Nayar Hospital, Mumbai. And sir has also done his MD and DNB in psychiatry. I welcome you, sir.
Thank you. Thank you.
And finally, we have Dr. Varun Jaitpal. Sir is a consultant psychiatrist at Katha Mental Health, a sexologist at Allo Healthcare, and also a consultant at Navicare. He has done his MD Psychiatry, DNB, and also has received special training in child and adolescent psychiatry and REBT training. I welcome you, sir.
Thank you. Thank you for having me over today.
Thank you, sir. Our goal today is to provide our MD residents, all the residents who have joined here, with a comprehensive overview of diverse opportunities that are available after completing the postgraduate training. We'll explore international perspectives, academic psychiatry, subspecialization, and private psychiatry, and we'll now begin with a panel discussion. Sir, so let's begin with the panel discussion. First of all, I have a question in general for all of you.
Drone, can we close down the PPT if it is not required?
Yes, sir. Sure, sir. So we begin with our panel discussion with the first opening question. Psychiatry offers a variety of options, be it academics, be it research, be it private practice, or be it super specialties, as you all four have been in. How did each of you decide on your current career path? And what were the biggest challenges post MD in choosing your career? Sir, Dr. Aniket, sir, you can begin, sir.
Right. I can put it in a bit of short answer because it's a very comprehensive question in itself. It's always a big dilemma once you so-called finish your MD psychiatry. And back then, when I finished in 2011, after my initial training at DPM, we didn't have the postdoctoral fellowships or DM psychiatry. They had just begun. I think the first year was 2012 when I had been in my senior residency. I remember NIMHANS beginning with sorry. Yeah. So I think the trajectory is pretty individualistic by all sense for all of us as to what we need to do and what we should do or what we can do. For me, it was probably determined by coming to Australia was totally by fluke, if I must say that. It hadn't been planned well before I was doing MD, and I hadn't thought of it. It was purely decided on an experimental basis, and I think I'm still continuing in that experiment for last 12 years here in Melbourne. Have learned a lot, have got different perspectives and all. But to put it in a more general sense, I would say it's good to start kind of thinking nowadays regarding what would be your mission and goal, and what exactly are you looking forward to in terms of your life goals. Because you're thinking of psychiatry as a career, and career is part of one's life. So I think one has to put it in perspective of other aspects and other priorities of life and take it from there. I think that's very, very important. And giving some time for oneself to hold and reflect and then take subsequent steps is something that's very important, is what I have learned from my experience so far.
Thank you, sir. Dr. Gaurav, sir, what are the biggest challenges that you faced in choosing your career, post MD? You have done, sir, DM, and how should the residents, can improve their chances of getting in their desired career path?
So basically, see, when I was doing my MD from Nimhans, we have the Center for Addiction Medicine unit in Nimhans, so where we get our training. So when I was doing my JRCP over there, I got really interested in the overlay between the medicine and psychiatry and the other dual diagnosis, and how the substances basically play their roles. And from there, I decided that I would do either PDF or DM in addiction psychiatry only. So post MD, the only thing was that how you should prepare about, and your preparation should go about your PDF and DM. So DM addiction is there in PGI Chandigarh also, AIMS Delhi also, and Nimhans also. But the PDF is only available at this point of time in Nimhans. Now the papers, I think for DM INI conducts, and for the PDF Nimhans conduct. And basically anybody who wants to take addiction psychiatry has to go from the basic to read about the basic. Either they can choose Kaplan or Tasman, whatever they want to choose, they can choose regarding their preparation with other study materials. Regarding why I have chosen addiction psychiatry, apart from my interest, was the prevalence of substance use were quite high. And apart from that, there are other frontiers which are opening in addiction psychiatry in the form of behavioral addiction, and there's always a dual diagnosis was there. So there's lot of you can say a lot of challenges are there, as well as lot of options are also now we are getting in addiction psychiatry. So one, if interested, can go about it.
Yes, sir. Dr. Sagar, sir, what motivated you to pursue a fellowship in child and adolescent psychiatry? And how is this competitive post MD?
Am I audible?
Yes, sir.
Yeah. So, thank you for inviting me. So the reason why I chose child fellowship is because I'm more interested into the neuroscience of brain, and understanding the neuroscience of brain means understanding it from the developmental trajectory from birth till death. So during our residency, we have enough exposure to the adult subset of patients, to the geriatric patients. So much of it gets covered up. But child psychiatry is something which is very niche, and the exposure is not as much as the adult patients is. So that is why I chose child and adolescent developmental psychiatry fellowship. The second thing is basically I was a resident at Nayar Hospital, and at Nayar Hospital we have a good child setup wherein there is OPD, there is IPD. We have a special school for autism patients, special remedial center for learning disability kids. So as I already had an exposure, I wanted to explore it more from a developmental trajectory point of view.
Yes, sir. So for Dr. Gaurav sir and Dr. Sagar sir, it was their MD journey that motivated them to pursue the respective career post MD Psychiatry. Yes.
Yes.
Dr. Varun sir, what are the major pros and cons of private psychiatry as compared to the institutional work? What motivated you to move towards private psychiatry away from the institution?
Basically, what the major pros and cons, I'd say the biggest pro is the flexibility. Like you said, that you get to be all rounder, you get to be your own captain, you get to decide everything, right? From your working hours, where you want to work, how you want to work, what subset of patients you want to see. You can choose it for yourself, right? From deciding your own consultation fees to having your own staff. So it gives you a lot of exposure and a lot of learnings apart from the subject. It helps in overall personality development of yourself. Another pro which drove me towards private psychiatry or having my own practice was the work-life balance. I was very clear that I want to give time to my family, and that is something which you can do when you are not in an institute. You can choose the number of hours that you want to give towards your practice and towards the family. Now, these are all the pros, but like they say, with great power over your practice comes great responsibility. So there are cons as well. You are on your own throughout, so there is nobody to fall back on. In an institution, you're always protected by your seniors, by your colleagues. You can have discussions. So that is one thing that is a major con. And another thing is the onus to drive patient demand. So in an institute, it's not on you. The patients do come in by their own selves. But when you want to have your own private practice, I think patient flow is a very big thing, which initially is very low, and it is up to you how you build contacts and a network in your area to get references, and that is something which is going to help you in the long term. So I think that is something which requires a lot of work initially.
So just moving forward on this, if a resident
Mhm.
wants to do a private practice, should
Mhm.
he go all in after MD, or should he join a medical college, get more experience, and then think of transitioning towards private practice?
Right. Actually, this is a very good question, and the answer is not very straightforward. The place where you do your residency from has a lot of value for the relevance of this answer. Because suppose the place you're doing your residency from is the same place where you want to eventually settle down and start your practice. Like I did my residency from Nagpur in NKP Sims, and then I had to move to Mumbai to start my own practice. So my long-term goal was always coming back home. So since I was for practicing, like I was studying in Nagpur for 3 years, I knew the patients from Nagpur, the patient behavior, what they expect from the doctors, but I did not know how the ecosystem works in Mumbai. So for a person who's shifting places post residency, I think they should take maybe a year or two off. They should join an institute, know the ecosystem, know the surroundings, establish contacts, and then jump into private practice. But if you are in the same city, what you can do is you can immediately start practice, because even after whatever amount of education you all take, learnings you all have, learning is a continuous process. So it is not going to end at a fellowship or a DM. It has to go on continuously, and you need to keep upskilling yourself. So whenever you do decide to start your private practice, initial 3 4 years or maybe a couple of years at least, you are going to have to put in the hard yards to establish a good patient flow. And sooner the better, I'd say. Like when you are young, there are not many responsibilities on your shoulders. That's the time when you can take that financial risk as well, and that is the time when you can take that plunge.
So thank you, sir, for mentioning a very important point that many of the residents might be shifting different states, probably not
Yes.
being able to get in the same state. So knowing the state ecosystem after that 3 years is again really important. A gentle request to all the participants to kindly mention your questions in the chat box. I'll definitely take them once the panel discussion is over. Thank you. Um, Dr. Aniket sir, what are the challenges in transitioning in terms of licensing, the difference in practices and your career growth of doing the Royal College of Australia and New Zealand College of Psychiatry?
Right. All right. So I'll just take you back slightly in my timeline. So it all depends upon what stage of life do you decide to kind of explore the overseas ventures, and what exactly are you aiming by immigrating to another country? What's your aim in psychiatry? What's your aim in other aspects of life. As Dr. Varun just mentioned, he's in private psychiatry, and it's important at a very early stage to think from a financial risk perspective and a financial input perspective. So all those things are to be taken into account. So, and the challenges start at that stage when you kind of make up your mind that, okay, I want to probably explore or I want to move overseas for XYZ reasons. Now, there are enough opportunities all over the world. Having said that, I can say, based on one of the annual review reports that was generated by our Royal College this year, that I think we get a lot of immigrants from UK. That's the topmost, the top tier country where most of the overseas trained psychiatrists come from. Second to it is in India at the moment. We were getting a lot of people from Canada and US at one stage, but I think they have tripped for the time being. The reason I'm mentioning that is basically because trainings within each of these countries is very different. Our Indian training is based from an Indian perspective and with certain trajectories that follow our careers or degrees in India. And one thing that stands apart is obviously not everything gets recognized, and when you move to overseas and vice versa, so their training may not be all applicable in India as well. And hence, when one decides to apply for training courses in a country like Australia, for example, what happens is that your career experience and which for a part of it is related to your degrees, but most of it is what we refer to as logbooks. I mean, the clinical work, that's when that gets scrutinized quite a bit. And that is something that one has to be mindful of, that what exactly one has done in their career span and training in India needs to be quantified and as well as qualified when you are presenting yourself towards at the entry point. So with respect to licensing, that becomes very important because that's where you get deemed as partially comparable, not comparable, or substantially comparable, especially in countries like Australia or UK. And plus your clinical experience is something that obviously takes a role into it. So when most of the candidates from India do get enter the partial comparability pathway, so in Australian challenges, you have to kind of find an employer while you are trying to immigrate, but also then you have to apply to the college independently and get the accreditation for the partial comparability parallelly, and then find a suitable training position, as a result of which few more training needs might be generated. Like, say, for example, a lot of candidates do get psychotherapy as one of the requirements, and there are exit exams, and there are clinical assessments and clinical certain niche areas, like some people may have extra child in psychiatry rotations or CL psychiatry rotations to complete before they can apply for exit exams and all that stuff. So that initial period can be a bit of a challenging period where until you have set your foot in, but plus also there is a lot of acculturation that happens in the initial phase. You have to learn new things, you have to unlearn few things from a career point of view that might have been very relevant in Indian practice and skills, but needs to be kind of undone and newly reformed and newly adjusted to the local needs. Australia is quite a multicultural society, and you do get people from all walks of life, all various cultures, and so do your colleagues might be from different countries. You might have to kind of accustom yourself to that kind of setting. And also, the other thing is it's a very multidisciplinary team work culture where you do work hand in hand alongside psychiatric nurses, social workers, psychologists, occupational therapists. So your head or boss might be a nurse, and you have to kind of respect that at times. It's not for a clinical governance perspective. Clinical governance things are very much defined discipline-wise, but it could be it's more of a corporate culture. So those are the challenges that one needs to go through it. And once you have had your license in place and fellowship in place, then the doors open for you to be quite flexible in your career. One of the reasons that Australia has been a bit attractive in last few years has been its work culture, work flexibility, and plenty of opportunities, not just from a personal growth point of view, but also your work-life balance, which is quite kind of well designed. Its work is very flexible here, even in a public sector or a private sector. You can mix and match. Public system and a private system works quite symbiotically here. So you can, just to put it in perspective, you can see a private patient in a public setting and vice versa. It is quite acceptable and it is quite a norm. In fact, there is nothing as such, which is quite a kind of a different thing for us when we come from India to kind of absorb it. Plus, similar to DM and PDFs that we have now in India, there are advanced training certificates that we call it as, which are parallel. For local trainees, they are ingrained as part of the fellowship. But for specialist international medical graduates like us, one needs to have if one is interested, based on your interests and abilities, you can pursue a specific area or specific disorder. Sorry, I think there is.
Yes, sir, just a minute.
सुबह में तो धूप में गए ना नवरंगपुर ऐसे वो भी 8 बजे निकली थी तो तब
I request Dr. Simra to mute her mic.
ये मेरे कबर्ड में जो ड्रेस है आपका एक ऐसा प्लास्टिक के उसमें
I think you can do that from
yes,
here.
Yes, sir.
Yes, Aniket, you can go ahead.
Yes. Yeah, so I think so and you have the liberty to work in a niche area. It could be disorder specific perspective. Streams like child psychiatry, AIDS psychiatry, addiction, and forensic psychiatry, for that example, are quite well defined here and quite niche areas to work either in public setting or in private settings. So you can continue to work exclusively in your fields. You can choose. So you can choose patients in public settings, private settings. One becomes even more choosy. So it's the trajectory is slightly different. So all those are the opportunities that comes with some challenges in relation to having to repeat some of the learnings that we have had through our MD Psychiatry and all. So one thing I said, I mean, from our Indian training and its background, it's quite solid in its fundamentals. So we do have quite a solid training and we should try to capitalize on it. What remains then is more of a process-based learning and also learnings that are more specific to Western culture and society. I hope I have answered it partly. I'll probably continue as and on, but I don't want to take time from other speakers.
Sir, so in the initial years, one of the participants is asking, in the initial years, do we have to settle in the peripheral areas? And then you can maybe, come in the central or the, rich cities. And sir, your last few points for the residents, takeaway points for, what would we advise them if they want to move abroad after MD?
Right. So firstly, no, it's not something that everyone needs to go to periphery first and then to central. It all depends upon what are the tools available at the moment and what are you aiming and what stage of comparability have you received. So in past few years, there were plenty of openings. I think the COVID worsened the demand supply gap to some extent, which is not the situation right now. Having said that, the settings that are quite comparable in public, in periphery as well as in central areas. So it depends upon your choice. So sometimes things you may want to migrate at place let's say Perth, and there are no positions coming up in that particular term for Perth. But if you're ready to wait, you might as well get that place position in subsequent years, or you might want to move to some other place. And people move a lot here. It's very much of a norm to keep changing services, to keep exploring different places. So it is something. It would be something like a person like me would be an exception. I've stick with my service for last 10 years or so now. But even then, I've worked with some other services parallelly. So it's pretty much allowed to work with 2 public health services parallelly. It can be, it's your time and it's your flexibility that matters to them. So yeah, no, the answer is you can move directly into central region as well. And for post MD students, my advice would be, I think 3 years, the first 3 years period after MD is a crucial period where one should try and capitalize to enhance their skill and not look MD as the full stop to your career and learning, especially if you're trying and thinking of moving abroad, and hone your skills further. Look at what probably was left out in your MD. Most importantly, I'll give you straightway answers for that. Child and adolescent psychiatry training and rotations, CL psychiatry training and rotations, psychotherapy, because there's a huge stress on that. And that is something I commonly identified lacunae in the training when the partial comparability assessment is done by the college. So those are the fundamental areas that needs to be worked upon. If you have some academic attachments in your Indian settings post-MD, be it in a form of senior residency, be it in a form of consultant position at an institute, that probably adds to a bit. Your research experience, which is, I know it's a huge thing in India. If you have to apply at a central institute or if you have to apply at academia, those things are totally different here in Australia, at least. And so I can speak for UK and Canada as well. You are assessed purely on basis of your clinical acumen, clinical skills, processes, and if you have a good academic orientation and academic perspective to it, that builds up your CV more than your publications.
Thank you, sir. Dr. Gaurav, sir, is PDF enough or DM is needed in psychiatry post-MD? And how do you see the relevance of super specialization in psychiatry, especially in the Indian context?
So basically, PDF is, if a person want to do a private practice, the PDF is enough. They don't have to go for the DM. But if they want to go to academic institute or central institute, then DM will have more preference than the PDF. Regarding the addiction psychiatry branch future, what now we are understanding as the prevalence of the substances and behavioral addictions, so those things are increasing. There's a huge demand going to be next couple of years for addiction psychiatry.
Sir, as an all-rounder, how do you manage the academics, I mean the teaching, the research, and your clinical responsibilities?
I'm still struggling on the academic part. But yes, so basically one has to make time schedule, okay? Because in addiction psychiatry, the major problem is the clinical work is a lot. So making a time becomes slightly difficult. So generally what we used to do whenever we get some time or we make a time like in a week, sometime we used to keep for our academic or for our research purpose. But clinical work is a lot in addiction psychiatry.
Sir, as you said, DM is only available in AIMS, in PGI, and at NIMHANS. What will be your recommendation if if any of the residents wants to open maybe or get attached to a de-addiction center regarding where they can gauge some additional knowledge or some additional expertise, because there are very less seats if we talk about the central institutes.
Uh, I didn't get your question. Can you repeat once again?
Sir, there are many less seats in the central institutes pertaining to DM. It's only in AIIMS Delhi, in Enhance Bangalore and PGI. So, sir, what any tips you want to give the residents if they want to be associated with a de-addiction center, or they want to start an own de-addiction center? Where can they get the additional expertise or knowledge pertaining to addiction psychiatry?
Okay, so I think PDF is enough for that purpose, which is available in Nimhans, and other central institutes are also they have started course of PDCC, post diploma certificate course. I think AIMS Kalyani is going to come in a couple of years, and there are certain courses which Center for Addiction Medicine runs, certificate courses in addiction, which which have on-hand training in the campuses also. They call you for a month training in the campus also. I think the name is Stop Program. They conduct in Nimhans. Okay, that is the certificate course which will enhance the training and skill set which you will require to run a de-addiction center or rehab center.
Yes, thank you, sir. Dr. Sagar sir, since you have been associated with the same hospital which has child and adolescent psychiatry, coming to a private practice or coming to starting your own practice in child and adolescent psychiatry, we need to have a lot of liaison with a special educator as we talk about various developmental disorders. What is your opinion regarding that, and can you share your
Yes,
insights?
yes. So, to give this insight, I would like to talk a little bit more about the postdoctoral fellowship program. Uh, so, in that, it's not only about attending the OPDs and the IPD patients, but we have various postings out of that too. Like we have autism dynamic intervention program, we have learning disability remediation program. There are medical legal cases that have to be seen, and certification for intellectual disabilities and learning disabilities. So during all these postings, what I observed is a psychiatrist has to work with special educators, a lot of social workers, along with that psychologists, occupational therapists, speech therapists. So if somebody is doing their fellowship and then going into private practice, uh, it will never be a solo work. A comprehensive, multidimensional team is required, and which should consist of occupational therapist, speech therapist, psychologist, a psychiatrist, and sometimes even a neurodevelopmental pediatrician also. So definitely, private practice is possible once the fellowship is done, but the setup requirement is more. So that is what I wanted to convey. What was your follow-up question? I did not get it.
Sir, in your institute, all the facilities might be available, but
Yes.
for many institutes, those facilities are not available. So
Yeah.
how can we, we need, what all we need to liaise when we want to open our own clinic, or maybe get associated in a private hospital that does not have these settings, this
Yeah.
options available?
So if we liaise with a hospital which does not have this setup, mostly we can work in the capacity of a psychiatrist only. So gradually we'll have to make a plan to bring in all these people who are needed in the child health care. So that is how we'll have to go about.
Sir, any additional skills that you require during your MD training that will help you in your fellowships for post MD pertaining to psychotherapy, be it research or any other skills that you probably need to develop during MD that can help you pursue those fellowship and perform better post MD?
Yes, yes. So whenever a resident is doing their residency, basically we have different fields: addiction, geriatrics, sexual health, child health, all these things. So if you are inclined to some of these things, you need to choose your mentors well. So there are many people who are working on all the different aspects of psychiatry. So if you like some part of the specific subtype of psychiatry, you have to choose your mentors. You have to regularly communicate with them. That is what I did. You have to ask them what books to read. Along with that, you have to request your faculty to give you those postings. For example, if I like child health, so I used to request कि हाँ मुझे और 2 महीने का extra posting चाहिए in the child department. So you'll have to ask for postings, choose your mentors, ask them about materials to read from. That is how it will guide you to choose the right way after your MD is complete.
Yes, sir. Thank you, sir. Dr. Varun, sir, what advice would you give the residents considering the private practice regarding how to build a patient base, how to develop networking, and manage all the rest of the administration task as well?
Right. So, like, firstly, I would like to agree with all the other panelists here that it is very important to keep building your skills or honing your skills even after you have started your private practice. So, that is one thing which you have to dedicate your time to. Now, definitely, for the networking bit to establish your patient flow, the first and foremost is you have to step out into the market. You will have to visit senior psychiatrists in your area. You'll have to meet them. You'll have to understand, take guidance as to what has been working for them for all these years. Once you do that, once you get that guidance, get that insight, you'll have to start expanding your base in terms of meeting other professionals, other colleagues from other branches so that you can collaborate with them. You can have cross referencing, and that is how that will initially help you to build your patient base. Next, what you can do once you've covered all the specialists in your area, next what you can do is you can look at social media. So today social media is a very powerful medium or a powerful platform where you can not just market yourself, but the bigger point here is to create awareness. Even today India is at a point where people do know about depression, but they do not know when to seek help or when, like, where to draw that line where you can have a home remedy as to taking some time out or being in a burnout situation or to seek the help of a psychiatrist. So that is very important to create that awareness. So if you can contribute to that, that would be great. And thirdly, I feel on the administrative front, initially, especially when you have a small setup with a few patients, it is manageable still when you can handle all the appointment rosters, staff scheduling and all of that. But eventually, you might have to look at hiring someone for even the administrative bit so that you can focus solely on the clinical bit, making a difference in the lives of the patients. So that is a brief, overlook of how things can proceed.
Thank you, sir. One general question to all the panelists. I hope many of the residents would also have the same question. With the advancements in psychiatry, be it digital psychiatry, artificial intelligence, be it telepsychiatry, how do you see psychiatry as a field evolving in India and globally, say in the next 5 to 10 years?
I think, especially in terms of technology, telepsychiatry, of all the branches, telepsychiatry is at the forefront because that is something we don't actually need to physically examine the patient to make a provisional diagnosis. Our branch is essentially history based or mental status examination based, which can be done even remotely. So that is something which we can do. We can even take history from the relatives over a phone call or a video call. So that is something which we can manage easily. In terms of artificial intelligence, definitely artificial intelligence is going to help us to zero in on the rarer diagnosis, which we do not see in general practice, or even you might not see in 3 years of your residency. So those diagnoses which otherwise would have been missed, can AI can help us zero in on them. But can AI replace us doctors or our expertise? Absolutely not, because at the end of the day, psychiatry as a branch needs that human touch. Most of the patients today in the IT industry are suffering from depression, anxiety problems, being amongst the machines only. So they do turn up here for the human touch, and I think that is something which is irreplaceable. So definitely we can collaborate and we can use the technology for betterment of psychiatry, but each one has their own role to play.
Let's take up certain questions from the chat box. How difficult are the entrance examinations for DM and fellowships? Dr. Sagar sir, Dr. Gaurav sir.
Yeah, shall I speak, Dr. Guru?
Yeah, please go ahead. Please go ahead.
Yeah. So I'll tell you about the child fellowship. Basically, we don't have any exam to get into a fellowship program. What happens is basically the final year marks are being considered, and based upon your final year marks in MD or DNB Psychiatry, you can apply for the fellowship to the particular university. If you're applying in Maharashtra, you'll have to apply to Maharashtra University of Health Sciences, to the particular state wherever the fellowship is available. And based upon your marks, the ranking will be decided, and then you'll get a posting. So that is how it works in Maharashtra. But I don't know about the other states. So regarding the difficulty of exam, so everybody knows what the difficulty of exams for MD psychiatry is. So that's about it for fellowship of child.
Dr. Gaurav sir, what are the necessary steps to apply for MDM or fellowships in India, and challenges to be faced?
Okay, so basically, the DM seats are actually more than the PDF seats at this point of time. We have 4 PDF seats in Nimans at this point of time in Center for Addiction Medicine Unit. And they conduct and they recruit this 4 PDF through general PDF exam. Earlier, they used to have a separate exam, but now it's been taken from the general PDF exam. So they pool all the PDF seats of Nimans into one general PDF, and they conduct exam, 100-question exam. And I think the number of participants are increasing. Each year we are seeing the number of participants are increasing. When I have given at that point of time, 80 or 85 people have applied, and at that point of time 2 seats were there only in PDF. Now they have increased to 4. So basically it was just the top 5 used to get. Some of them will choose the DM, or some of them will choose the PDF, and that's how it was earlier. But now the DM exam being conducted by the INI. It's a separate exam which INI conducts, and they pool the seats of all the places where the DM seats are there. Now AIMS Gorakhpur has also opened DM seat. They have one DM seat in AIMS Gorakhpur also. So now the central institutes are increasing the DM seats. So the number of DM seats are more than the PDF at this point of time. So PDF exam is slightly might be more competitive, and it's a 1 year. PDF is a 1 year, and you don't have to do a thesis. The thesis is a tough part, which in DM you have to do again. Okay. So that is one plus point of doing PDF. Okay. Regarding the competition, it's increasing with as year is increasing, the number of participants are more.
Sir, is the residency during DM similar to the MD, or you have additional roles, responsibilities, and
Okay.
even
So
more things to do?
I can tell you, I can tell the perspective of Nimhans what we used to do here. So here we used to work as a resident also, and we also used to do the supervisory role also. So our work was to teach junior residents also, and to manage the ward also. Okay. So it is a difficult job because the responsibility is now more on you. Okay. In AIMS and PGI, the similar things are there, but in AIMS, I think uh, they don't have the junior residents or the junior resident post. Something is there. So the work in AIMS is slightly difficult, slightly different than the Nimhans. But yeah, the responsibility will be quite more, and you have to present cases, and they will have your separate academics will be there. So yeah, the role and responsibilities are more in senior residency in acad.
Gaurav sir,
Thank you, sir.
there is thesis program for fellowship too in the 1 year. Yeah.
Where in your
In Mumbai, in all over Maharashtra, wherever the fellowship programs are there, KM, JJ, Nair,
okay.
dissertation is there. Yeah.
Okay, here also in Nimhans also is there, but not like the DM thesis. It's not in that intensity they do. In DM you do generally. Here we go for this original work and all those things. So that's also a pressure on acad SR. But in PDF, that is the lesser intensity is there of that research work. But yeah, the paper they would present. They would present a paper.
Dr. Sagar sir, any opinion regarding the child and adolescent psychiatry in Sri Aurobindo University or the consultation liaison course in AIMS Jodhpur? How are those courses?
No, doctor. I have no idea about it.
No idea. Dr. Aniket sir, so any idea regarding the future of psychiatrists in Middle East?
Well, I have few of my friends and colleagues in Middle East. Now, I'm not sure whether someone is asking in terms of migrating from India to Middle East or rerouting via UK and Australia or Canada. I'll give answers to both because I have a bit of perspective to it. I think when we consider Middle East, most of the people would think of Dubai and Abu Dhabi. But there are opportunities scattered across in the neighboring countries and I mean peripheries within Middle East as well. If you decide to kind of relocate from India to pursue a career in Middle East, post your MD, DM, whatever it might be, I think you are straightway competing with someone who has done their fellowships from UK and other countries. And hence, I think there has been a slight bias in my personal opinion, even though the skills might be definitely higher, but these countries have been slightly biased towards those trainings, despite our candidates from India being at par with the UK born, I think, because that's the country that probably it's favorite amongst Europeans and UKites to they would usually venture out for a couple of years in Middle East, try their hands on. It's a tax-free country, so fill up their bank balances and move back. That's a very common trajectory that I've known. People from Australia, it's not as popular as a destination considering the logistics and the sheer distance. And also, obviously, again, I think in Australia we do get spoiled slightly with our work-life balance here. I have a couple of my friends working in Dubai at the moment who graduated and who tried their hands-on in Australia, but didn't find it suitable for and decided to relocate to Dubai. I think it's again the work. It can be a bit strenuous. It depends upon who is your employer there. It's pretty hard to get into the governmental sector and the bigger corporates. I think that the middle range corporates are the ones who are accommodating a lot of Indian trainees. But I think it's a good stopgap. It's a good place to try if someone is desperate. There's nothing to lose. That's what I can say definitely.
Are the certificate courses sufficient for suffice for any super specialty practices?
Are you asking to me? Sorry.
So for in India, like I would ask if any certificate course of foreign universities are they sufficient or they suffice for doing super specialization, equivalent to super specialization in India? Getting any foreign certificate course of maybe European or maybe say a US course, and is it equivalent to the super specialty? Do we get the same expertise required?
It depends. It depends upon what you want to get out of it and how do you apply it. If you're aiming to apply it in a private setting, private practice in India, and if you're looking forward to getting into some big corporate group within India, that might be somewhat a point of attraction for them. I think so. For most central institutes, we are inundated and occupied with our own people and candidates and their expertise. So, I'm not sure whether that would be straightforwardly taken into. Having said that, obviously, I mean, since being an alumni at NIMHANS, I know there have been people who have done some reverse migration over years. Gaurav might be knowing Dr. Senthil Reddy, who tried his hands on, and he was in Australia for quite a number of years as a faculty at NIMHANS. There are a couple of others who have reversely migrated and been doing private practice based on the skill set that they got equipped with. They're based some group practices in Bangalore at the moment, and they do shuttle between Bangalore and Australia. And you do have an opportunity to do locums couple of months or based on your choice in anywhere in Australia and balance it out with your private practice. I think that's the model that I'm aware of, and that's how people have utilized their skill set that they have gained through any sort of trainings abroad and try to implement it. So the community psychiatry model is what probably most of them have been trying in their practice, what I'm aware of.
Yes, Dr. Varun sir, you wanted to say something?
Yeah, like regarding the certificate courses, I think they are a very good option, especially while you're doing private practice, because they do not demand specific number of hours like during the day. They are self-paced. Most of them are self-paced, so you can actually attend all the lectures maybe over the weekend. There might be a live class through the week sometime, so you can attend that, and that helps you to keep upskilling. Now, at the end of the day, whatever education, degree, certifications that we are getting, it's all to learn how to treat the patient to the best of our capabilities. So to keep learning and keep upgrading our knowledge, it is very important. And these certificate courses actually do offer, a quick fix or a quick solution to that upgrade. It's like the upgrades which we get on our phones. You don't actually change the phone, but you get introduced to new features. And especially in private practice, word of mouth is a very powerful tool. So once your patients start to recover, once they start seeing a difference, I don't think most people, especially in India, check out for the qualifications of the doctors. That is why, sadly, a lot of quacks also gain a lot of market share and do well in their own, false fake practices. So if you are living up to your capabilities, honing your skills, and doing the best for the patients, I think certificate courses are a very good option to upgrade your knowledge.
Sir, are there any unexplored opportunities in psychiatry that the residents can explore? Something that maybe you feel, out of all of the four panelists, if you feel something that you might have missed and now it is really, taking up pace, something for the residents to explore that has not yet been explored in psychiatry.
Online consultations are one such thing. So the prevalence and incidence of the disorders is increasing. But there are many people who don't want to go to a private setup or to a doctor physically to meet and show. So now many people are comfortable to show to the doctor through online consultation. So that is one significant change, and all the young psychiatrists should explore it. So we at our clinic get physical patients, but there has been a rising trend in the online consultations also. So much so that it's almost 50-50. I'm sure all the other practitioners might also be experiencing the same.
Dr. Gaurav sir, how do you maintain a healthy work-life balance, and how do you prevent burnouts if you have any in your day-to-day routine?
I'm still struggling to do so. Now, see, during my residency, it was very difficult because it was very hectic work schedule here in NIMHANS. But now, over a period of time, when I have become the consultant, now I'm able to maintain some degree of it balance. But yeah, during my residency, it was quite difficult because the number of cases workload was quite high.
I can slightly add to what Dr. Gaurav mentioned, and that question is very close to my heart at least. It's one of been something that brought me to psychiatry and laid the seeds, and I owe it to none other than Dr. Sudhir Bhave. He may not be aware of it, and I haven't had ever direct interaction with Dr. Sudhir Bhave anywhere around this, but I remember my MBBS days and hearing to one of his talks about how attracting people to psychiatry and being a field where you have your evenings free. And it may not be true for all time and for all the people, but that is something that stood with me while I kind of decided to pursue my career in psychiatry, and almost became my mission and vision to an extent. That is something that I've always strived for. It is something that is something that we have to see and reflect inwardly, and because work can get hectic no matter where you are and what you are doing. It is something that how do we draw boundaries around it, and how do we put other aspects of life into the perspective and priorities. Currently, I work 4 days a week and keep 3 days to myself for my other aspects of life, and that is something that I found really healthy. I had my burnouts, I had my frustrations and trajectories relating to where my career became kind of overpowering to other aspects of life. But I think that mission stayed with me, and that is something that I've really enjoyed. I think that is doable. That is something that we should strive. It's probably more of a inner phenomenon than what we can normally attribute it to external factors. Is something that needs to be clearly defined. We have to look for after ourselves, only then we'll be in position. And psychiatry is not a kind of an easy field. By that means it exhausts you quite a bit. In the sense that even though we may not be standing like surgeons and utilizing our physical energy in that aspect, but it consumes much more of our mental energy and mental health. So it's very, very important for ourselves. And that's why I said, yeah, the first few years after MD, it's very good time to kind of reflect on all of this and define your goals accordingly based on your trajectories of life and what exactly are other aspects of your life. Because things are going to change, priorities change every decade of life. Things that matter to you most in your 30s may not be very relevant at all to you when you are in your 40s and when you turn to 50. So things have to be taken into perspectives, and rather than just building up on it and running behind it may not be the goal. And us in India, one thing is very peculiar about us, that we are in a constant state of hurry to build up our goals and pursue them as if we are going to lose the train, where it's just like if this train is gone, there is a next train that's coming our way. That is something as a learning lesson for me, has been a learning lesson for me, looking at people from different cultures there and taking their life stories. And as careers, we have the latest of my student was a 60-year-old woman who was a cardiology nurse who decided to change her career path at the age of 52, did her medical course, and she was doing her psychiatric training at the age of 60. And her son was doing a radiology training parallelly, and both of them were in the student life. So things happen. People do go in different ways, different trajectories. People decide to migrate overseas at different eras of their life, different stages of their life. So everything is possible. It's just that we have to kind of prioritize ourselves before our careers as well.
Definitely, sir. I request our chairperson, Dr. Sushil, sir, for his expert opinion and his comments.
Okay, yes, we are running short of time, and this is a signal by drone. So I'm extremely, extremely thankful to Drone and all the panelists, Aniket, Gaurav, and Varun. And when I thought about a person from abroad to be a panelist, I thought Aniket would be a very suitable candidate for this panel discussion. Why? Because he has done his graduation from Nagpur and then post-graduation DPM from Nair. So two institutes from Maharashtra. Then he had done MD from Nimans. So then third institute of India, and then he went to the Australia. So he's a right person to have a balance. Similarly, for the DM person, I thought about Gaurav because soon after his DM, he started working in a AIMS Nagpur, where he get to see or get to work in a capital of addiction, I would say, capital of tobacco addiction, Nagpur and the Vidarbha. And maybe the kharra word may be a very usual word for Gaurav nowadays, because this is a very unique composition of the tobacco available in the heart of Vidarbha. And I thought of Sagar because of his close association in NAR department, and he's a very inspiring person from many youngsters. Varun being my own student, and he was a very scholar student during his MD, and means looking at his academic achievements during his post graduation, I'm very sure, and I was expecting that he would think of going for postdoctoral fellowships or the DM super specialty. But then very wisely, he chose to do a private practice and being associated with some institutes. So I thought intelligent person like Varun can think of this option. It means there is something behind it. So yesterday there was a farewell program for the postgraduate students in our department, and I told them, when we think about the super specialty fellowships or the DM or anything or a private practice, it depends upon the your background. There are some people from the rural areas of Maharashtra coming to our college for post graduation, and for them it becomes so important that immediately they should start earning something to look after their families. For some people, they are from such a rural areas that there is hardly a psychiatrist in the district or in that particular tahsil. So they have a necessity to go back and to the serve to their community. So it's not a measurement which will fit everyone. Means we have to think about our opportunities, our background, and then look for the opportunity. Everyone, a same suit will not suit everyone. So you have given a very balanced approach to all our participants. And to remind you, there were 107 postgraduate students had joined this panel discussion, and never ever we get opportunity to listen through the perspective of every different people who are working in a different capacity at different places. So I'm extremely thankful to the panelists and looking forward to the similar cooperation for the future sessions of Postgraduate Education Committee of Indian Psychiatric Society Western Zonal Branch. Thanks again, and thanks Drone for this wonderful moderation of the program. Thank you all of you.
Thank you so much, sir, for your insightful remarks. I request Dr. Sudhir Bhave, sir, for his final closing comments. Uh, Dr. Sudhir, sir?
I think he's not there.
Yes.
I think he's not
there. We have had a truly insightful discussion, and I want to express my sincere gratitude to our four esteemed panelists, Dr. Anish Shukla sir, Dr. Gaurav Kumar sir, Dr. Sagar Bhalke sir, and Dr. Varun Tejpal sir, for sharing their valuable expertise and sharing their valuable time with us. Your diverse perspective has provided our residents with comprehensive understanding for the future career paths post MD. A special thanks to Dr. Sushil sir for giving me this opportunity to moderate such a wonderful session. Thank you, Dr. Sudhir Bhave sir and Dr. Sushil Gawande sir, for their ever-ending support and their opening remarks. Very grateful for their participation in this scholarly Sunday session. Of course, thanks to all the residents who have joined today. Your participation and your insightful question made this session truly engaging. Thank you so much.
Thank you.
I would just like to add one thing. Actually, what would help anybody choose their future career path would be just asking the most cliched question an HR asks: where do you see yourself in 5 years? If anybody answers that question to them